This is KTN News.
Welcome back. You're watching Morning Express. Today we are focusing squarely on COVID-19 and the possibility of mass testing in certain communities that have been flagged as flashpoints for the spread of the virus. And with me in studio is Dr. Samrat Shah and Alan Maleche, who's the Kenyan Executive Director, giving us their expert opinions on why mass testing is necessary and why certain communities are more vulnerable to the spread of COVID-19 and why they need to be approached in a specific manner. Now, I'd pose this question to Mr. Alan Maleche. And when it comes to normal diseases, there are certain communities that are already vulnerable. And of course, when it comes to them trying to get normal testing and normal treatment options, it's actually quite difficult for them. And they do suffer more because of the inequality that is spread in the country. And it's an African issue as well. So when you see the spread of COVID-19 in specific neighborhoods, let's talk about the Kawangwaris and Isili and certain urban settlements, what do you feel about it? Does it evoke panic in you?
Well, it doesn't evoke panic. It evokes the frustration that we have had a constitution since 2010 that has tried to ensure that we address certain important things such as the right to health, the right to food, the right to sanitation, and the right to housing. However, we have dragged our feet as a country, particularly the executive and partly the legislature, in ensuring that we have a framework in place that sees these things that are addressed. So what you see in some of the urban settlements is the fact that if you're not addressing the social needs of people, I do remember I saw a tweet from someone from Kawangware who said that before you test me, please test about my hunger and see how you can address my hunger before you test me. So you've not addressed his social needs and you want him to test. Yet there are things that are making him not to be able to comply with physical distancing, to either wash his hands with clean soaps, but yet you're then blaming them and saying they are not doing their part as citizens. So I think the government equally needs to be able to play its part and have a plan to say, for persons who cannot afford, for people who are more vulnerable, for people who are facing more inequality, what is my scale-up plan to ensure that I address the vulnerabilities they have so that I can then address my strategy of either mass testing or my strategy of promoting good hygienic behaviors to be able to have success to work. But what we see here is more citizens do this, do that, do this, and government less of what they are doing in terms of their own obligations, the needs of the people. And as the doctor and my colleague on the panel have said, you must find a model that fits for you. If mass testing is the model that will work for Kenya, how do we make it work? Because clearly physical distancing is not a model that will work in Kawangware or Mombasa Old Town or in Kisumu in Uganda. That will not work at all. You can't expect anyone to physically distance there. So what solution works for us to be able to ensure that we are successful? And also I want to emphasize the fact that we need to think through how we are working around this issue with healthcare workers, because many of them are getting exposed, and if you're not getting them to either have repeat tests or to address the issue of mass testing, we are on a very slippery slope, because if a healthcare worker gets sick, then we're going to have a large shortage of people who are available to take care of us. So I think the issue of healthcare workers must be closely looked at. And I think part and many of them, their fears around the cost of treatment, the quality of a quarantine, and the ability to address the stigma that comes with even a positive test or actually taking the test themselves. And would also want to see, as was the case of HIV, and I'm not comparing to HIV for no reason, but even if you look at it from the perspective of HIV, we have very few leaders in Africa who have publicly declared their HIV status, though even who have openly spoken about stigmatizing diseases. Could we see some of our leaders, as we've seen with journalists like Mark Korir, publicly taking a test to be able to make people understand there's no fear about it? Could we see some of the leaders going to Old Town Or going to Kawangware, could we see the member of parliament and MCAs also lining up with the people in Kawangware for the mass testing so that they can then be able to ensure they are setting a good example as leaders to show people that it is important to do this test. Most importantly, the testing must respect rights, it must respect informed consent, and most importantly, how your results are communicated after the test is very important. We have seen situations where ambulances rock up in people's estates and people are taken away, and that's how people then know so-and-so has coronavirus. Is there a better way that we can do on how we communicate results and how we evacuate those who may have had a positive test to avert the issue of stigma and fear among people within the estates?
Absolutely. And also we have had a lot of speculation on how the monies put aside for the fight against COVID-19 are being allocated. Do you think, are you satisfied with the representation of such communities in when the budget is done? Could more be done for a more pointed and targeted way of handling certain communities as far as the funds and resource allocation is concerned?
So in terms of involvement of the community, I think we already have the constitution that provides ways to engage in budget making and provide information. And I think many Kenyans have really stepped up to give feedback and information to either parliament, to either Senate around what needs to be done with budget, also to the National Treasury. The only difficulty in this country is that sometimes public participation is more of a PR exercise, and it's never clear what you submit, whether it's taken into account or not. And I think there's an onus on government to demonstrate all the feedback they are getting, be it on social media, be it open letters by citizens or organizations. How are they taking that advice into account? Because it seems they are only listening to themselves and not appreciating the feedback that they are getting from people. And I think the issue of transparency is what is a problem here. Because the last time we ever had a press briefing about test kits was weeks ago, where they told us how many test kits they had when they were beginning mass testing for healthcare workers. Since then, we do not know how many test kits are in the country. We do not know how many reagents are there or not, how many people have been reached so far with the mass testing. Have we covered the priority population of healthcare workers before we move to the people working in the hotel industry? Have we covered all the hotspots? So such information would be helpful from a transparency point of view to see how things are going. And with the recent reports, Ministry of Health submitted to Parliament that they are denying now, it clearly shows they have funding from various donors to buy test kits, to buy reagents, to be able to take care of healthcare workers, but how that money is being used is not very transparent. I know there's a big hula baloo about the tea, which is also important, but the way, if you look at the report that they themselves submitted to Parliament that they are now backtracking, it clearly shows they do have funds. And why they are not spending the funds, or if they've already spent it, needs to be a question where they come out honestly and they're able to tell Kenyans, because the breach of that trust will make people not want to take up tests. If I'm stuck at Kenyatta University Hospital for paying a bill 90,000, and yet I'm seeing the government has money for tea and communication and printing papers, I cannot correlate to why I'm being detained for lack of payment when the government has funding to be able to pay for my treatment. So the government, particularly the Ministry of Health and the National Emergency Response Committee, must be very clear and more transparent. Not only through press briefings, they should provide live portal on their website that shows how money is being spent, the number of people who are being tested, the number of people in quarantine, and the progress that they are making. Right now, we are only left with what they give us during the press briefing and what the journalists can ask in terms of the limited number of questions that they have. So a bit more is needed from them to be able to get their buy-in. Without buy-in and trust of the government, any public health measure will not succeed. And I think Sierra Leone demonstrated that with their Ebola experience. We have the capacity to be able to address COVID, but the government needs to step up to get more public trust on how it's using resources and what evidence is informing their strategies.
Okay, and Dr. Samracha, I'd like to pose this one to you. When it comes to communities, he's talked about how to be transparent and how to be clear to communities so that they can take this seriously and know that we are all in this together to fight and make everything better. We've had clips running around, and we ran this yesterday on the show, where President John Pombe Magufuli had some very interesting tests that he did to on the testers of coronavirus, whereby we had inanimate objects, as he put it, testing positive for the coronavirus. I mean, could you explain to us the mechanism behind that and why it's important for us all, particularly in Kenya, to take testing seriously and not, and how detrimental it could be if we cast a shadow of humor or doubt on certain mechanisms of testing?
As I previously told you, the testing is done from a posterior pharyngeal swab.
Yes.
So when you take a swab from the posterior pharynx, that swab is put on a machine called as reverse transcriptase PCR machine.
Yes.
And now from that area, we take the virus particle. We start multiplying the virus because the virus is so small in size that it cannot be seen on a microscope.
Yeah.
So we multiply them several times, and then when it is multiplied, that is the point when we get the number of copies available of that virus, and then we get to know whether it is positive or negative.
Yeah.
This is the way PCR analysis works, not just for COVID-19, for that matter any other virus infection. PCR analysis works in the same way.
Yeah.
So now this PCR analysis takes a time. So we say around 24 hours time is required for one report to generate. So that's the reason why we are getting time limit also for the virus testing. Apart from that, as we discussed about Tanzania having testing so many things, so many rumors being spread out that the test kits are not very good, the testing facilities are not very good, there are false positive reports coming out from the floors, from the engines and all these things. But I think we need to understand the fact that the virus can survive on any other surface for that matter. The virus not just multiplies on human beings, it is also surviving on floors. We have seen that on a steel, on a plastic, on a table it can survive for 36 hours. How did they get to know about these data? It's by testing these things.
Yes.
We talk about social distancing and quarantine, social distancing of 1 meter. How did we get to know that it is 1 meter and it's not 2 meters? It's by going for testing and finding out till what extent the virus can come positive.
Yes.
Yeah. So I think let's not talk about having rumors and false positive tests, and because of these things, people avoiding the testing, thinking that no, this is not a good test, this is just giving a false positive reports or a false negative reports. In fact, because of these, the rumors are spreading very faster and creating more loss to us as community than creating awareness. So I think what is more important right now is we go for mass testing, avoid such kind of talks, and think about a longer term aspects of COVID-19 and get tested ourselves.
Yeah, because of the fear, people might actually take comfort in the doubt that is being cast by some of these rumors and just go with it without knowing that they're actually endangering themselves by not going for testing or, taking the necessary measures. Mr. Maleche, as we finish, the situation on the border between Kenya and Uganda is not ideal because there's a long queue of truck drivers and they have been accused of being a part of the problem. What do you make of that situation whereby Uganda is saying no to people not to come into the country before they are tested, as we wind up the conversation?
My view would be that Uganda is trying to take precautions to ensure that those who come into their borders do not bring the virus in. And I think it's not only truck drivers. We have seen people who are being evacuated out of Kenya to their countries or back to Kenya are required before they board the flight to produce a COVID negative test. So that is not a unique practice, but I think it casts doubt to our strategy of testing and to find out why did we figure out that truck drivers may be a high-risk population and also include them at the early stage as part of the people who need to be tested early. And I have seen reports from Uganda where they have tested a number of truck drivers from both Kenya and Tanzania who have turned positive, which means at the Kenyan level, we missed those cases. And so I think as part of the solidarity in East Africa, both Kenya, Uganda, Tanzania, Rwanda, Burundi, and now South Sudan should have a conversation and figure out how do we stop the virus from spreading between us at the borders. What collective responsibilities can we have at each of our borders? And again, this calls for transparency from all the leaders who are members of the East African community around how we can strategize as a community to be able to ensure we win the fight against the coronavirus. But just as I conclude and I want to say, I think it's most important that we must address the issue of fear, we must address the issue of stigma, and that if those are not addressed, you will see many human rights violations happening in the form of people being put in quarantine, that is of poor hygiene, people being detained in hospitals, that it's happening at Kenyatta University for lack of payment of their treatment for COVID. And eventually the government will be dealing with numerous lawsuits, and eventually they may be using their fund to pay damages instead of buying test kits to be able to treat people.
Thank you very much, Mr. Maleche of Kellen. Alan Maleche is Executive Director, Kellen. Thank you so much for your expert insights. Dr. Samrat, your closing remarks as we wind up the discussion.
Yeah, I think people in the community should understand that testing is very much important today. And unless we go for mass testing, unless we come up ourselves and inform the healthcare facilities that no, I'm having the symptoms, I have met this person who was tested positive, and we volunteer ourselves to get tested, I think the situation is not going to cut down. If we continue being reluctant, if we continue being stubborn and avoiding the situation, the situation is going to go longer than what we expect. So I think people should be more aware about this. Don't have that fear of coronavirus. Don't have that fear of testing. Avoid having false talks and rumors, and get a positive attitude and get tested yourself. That's the most important thing to be done.
Thank you very much, Dr. Samran Shah and Mr. Alan Maleche of Kellen for being a part of this very important conversation. Mass testing is necessary, and also it's important for you to actually volunteer if this is being offered in your neighborhood. As the Mombasa governor put it, that might be something you must take advantage of, because this test could also be quite pricey. I'd like your opinion on this, and why do you think Kenyans are shunning the mass coronavirus testing in various quarters of the country? Why do you think Kenyans are shunning the mass coronavirus testing? I'm at Trix Ingado. Michael is at Michael G. Gitonga, and the official hashtag is KTN Morning Express. On the other side of the break, Michael will be telling us how to spend time, and of course some physical activities are quite necessary, and he'll be showing us how to perhaps make sure you can keep yourself active out there and enjoy yourself without necessarily socializing or being in close contact and putting yourself in danger. Some of the things that he did do out while on a ride will be focused on the other side of the break. So that is coming up right next. But for now, let's take a short break.